health is something that matters to all of us. Shy, and I'm excited to be your host for this live. Oh, I'm shy. Perfect. We've got a great show lined up. We'll be talking with Dr. Kumar Vadivel, also known as Dr. V. He's a super smart dentist who knows a lot about teeth. He's going to tell us about the newest things in dentistry, how to keep our teeth healthy, and ways dental care that doesn't cost much. Whether you know about teeth or just want to learn how to keep your smile bright, you'll find something interesting here. We'll cover many topics like why brushing your teeth is important and what's new in dental technology. We've already got some questions for you, our viewers, and we'll answer them. Plus, you can ask more questions during the live show. Before we start, let me tell you about Dr. V. He's not just any dentist, he's a periodontist, which means he's an expert in certain types of dental care. He works with ToothHQ Specialists in Dallas, Fort Worth area in Texas, and guess what? He's even writing a book that's coming out next year. If you want to know more about Dr. V, check out our website at mytoothhq.com. So let's get comfortable and ready to learn lots of cool stuff about taking care of our teeth. Let's begin our dental live show. Welcome, everyone. And now let's welcome Dr. V and start our show.
Awesome. All right, let's
Yeah.
do it, man. Let's do it. Okay. Hi, everyone. I'm Dr. Kumar Vadivel. Most of you guys know me, but you can call me Dr. V. I'm really excited to be here for another show with you all today. Let me tell you a little bit about myself for the new people. I'm a board certified periodontist, which means I'm specially trained in taking care of gums and bones that support your teeth. I'm also skilled in dental implants and oral surgery. I'm part of the American Academy of Periodontology and American Board of Periodontology. That's just a fancy way of saying I work with a group of dentists who are experts in gum health. I started ToothHQ Dental Specialist in Dallas, Fort Worth. We have 4 offices here. We are all about making sure your teeth and gums are healthy and strong. Now I'm here for you. I would love to hear any questions you might have about your teeth and gums, and you can ask us questions live here right now, or even send them your questions for our next show. Your questions help us make these shows really helpful for not just for you, for everybody all around the globe. And one more thing, if you like what you are learning here, we want to hear from you. Please let us know. Your feedback is super important to us. Don't forget to like and subscribe to our channel so you won't miss any of our cool stuff about our latest and greatest updates and helpful tips on about your dental health also. I'm so looking forward to talking with you here and answering any questions, and let's make our smiles the best they can be, right?
Perfect. Yeah, doctor. Are you
Awesome.
ready?
Man, I am so
Okay.
ready.
Well, let's
Yeah.
get started here. Hi, doctor. I have bleeding gums, and my dentist diagnosed me with gum disease. They recommended Biolase treatment and Lanap. I'm not entirely sure what these treatments involve. Can you help me understand which each one is and what would be best for me?
Great. Well, it sounds like you've done your research about the gum disease and what are all the treatments available. So, uh, the treatment that you mentioned, the few treatment, which is the Biolase
Uh huh.
and
Lanap.
the Lanap. So those are the two different types of treatment that are available to treat the gum disease, and specifically when people have advanced gum disease, and sometimes the traditional periodontal surgery cannot help, and we want to try all the armamentarium that is available. So the advanced gum surgery just alone, I should have said just alone. We also try to decontaminate the area with the bacteria, to try to decontaminate the bacteria with the laser. So both of these, the BioLace and Lanap, they try to really help those patients who will also benefit by incorporating the laser. It really helps, and those are two types of treatments that are available. If you happen to be in the Dallas Fort Worth area, come see us because we do have both the BioLace and the Lanap available in our office. And whether you are a good candidate for Lanap or BioLace or not, either one of those are I should say, not that the gum disease cannot be treated if your dentist or the periodontist has only either one of those type of lasers available. Again, talk to your dentist or the periodontist to see whether you are a candidate for laser treatment, whether it can be handled either with the LANAP or the BioLase procedure.
All
And, and,
right.
and then to answer your question, which one is the best? Um, Either one can be the best option depending on your gum condition. Again, your dentist or periodontist should be able to answer. And if you happen to be in the Dallas Fort Worth area, come see us and then we'll tell you what is the best option for you.
Definitely come and see us. Absolutely. Doctor, we have another question here. I'm a paramedical staff member working in a polyclinic setup. I've seen many smile transformations where they fix all kinds of smiles beautifully by cutting the teeth and placing crowns. Doesn't shaving teeth damage the teeth and gums in the long run? If so, why is it done so often? Can you shed some light on this topic? That was really good.
Fantastic question. If you guys remember, seeing the show, it used to be like right on the TV. They used to do the Smile Makeover.
Mm-hmm.
The Smile Makeover show. It's an hour-long show. It used to run on the TV. They can show you exactly like after about an hour or so later how the smile can be transformed into like a beautiful smile. There is no harm in doing it either way. It really depends on the condition, really depends on whether you are a good candidate for or not. And uh, I can completely understand your concern that whether cutting the teeth down are going to completely damage your teeth or not. Sometime, depending on what your expectation is, we have people, they come see us and then they say they completely knock off their teeth and then they want to get their teeth done on the same day. We place implants
Right.
and then we put a crown on the same time and then we get it done on the same time. Or sometime, depending on the condition, we can't really do the procedure on the same day. Same thing here. If you, let's say, for example, you're getting married and you're ready to get the smile makeover done to get ready for your wedding, and the next like about a month or two, going for traditional braces may not be possible, and you still want to have the beautiful smile. And can you go with the option of a smile makeover in that condition? But of course, as long as you understand that shaving down your teeth, not necessarily cutting, is going to completely damage. There are multiple options available. We nowadays with the technology, we can even do what we call it as a prepless veneer. You don't even have to completely prep your teeth at all. You can just put some veneers on there to do a complete smile makeover. Again, um, without looking at your teeth, we can't really tell you whether it is going to completely damage your teeth or not. So talk to your dentist or talk to your periodontist if you happen to be in the Dallas Fort Worth area. Come see us and we can help you as well.
Come see us. Absolutely. Okay. So, doctor, we have another question here. I'm 27 years old. I'm not happy with my smile because my gums are dark. I'm getting married in December. When would be the best time to get my gums whitening for the best results? And should I continue to get it done every year?
Do you know what gum whitening is?
I actually don't. I've been in the field for some time, doctor.
Man, that's not a good thing, right? You don't know that. Like let all educate ourselves, right? Okay,
Yes.
perfect,
Fill
yeah.
me in, doctor.
So, but you did ask the question like I think 2 days ago or like yesterday, a few days ago. So
Uh-huh.
tell me, like, what is your understanding? What the caller is trying to ask? Yes.
Sure. So sometimes when we're melanated, we have darker gums. So I didn't know that was something that we could change.
Absolutely. Okay. So what this caller is talking about is, sometime the gums are darker, and particularly some ethnicities, they do have some darker gums as opposed to the other ethnicities, and then sometime people may have darker gums than other people. So that is what, like, that we are talking about here.
Mm-hmm.
So there are options available. So it looks like this caller has done the research, and that's why they are asking. So what we do is we use a laser gum treatment, specially to kind of what we call it as a depigmentation. Imagine like you have a darker skin here or some kind of a darker pigmentation here, and we want to depigment the area. So we pass the laser to depigment the area so that become this area becomes kind of blend with the other part of the skin. So imagine like this is your gum and you have some darker pigmentation around the area. So what we do is we exactly do the same thing what I described here. So we pass the laser to completely depigment the area so your gums kind of blend, and now you have a lighter or a non-pigmented gum. That's what we are talking about, and that is absolutely possible nowadays with the laser treatment that we have, and
Yeah.
we can do that. And again, talk to your dentist, and if you happen to be in the Dallas-Fort Worth area, come see
Come
us.
see us.
Hmm.
Absolutely. Okay, well, that's very cool. You guys definitely make sure you're looking into that if you're interested. We have another question here. I recently underwent a laser treatment and I'm feeling slightly sensitive in the teeth in the treated area. Should I be worried about this, or is this a common to experience sensitivity after a gum treatment? Hmm.
So, experiencing sensitivity after the laser treatment, it is not uncommon, and not necessarily just the laser treatment. Even when you undergo deep gum therapy, it is not uncommon. Sometimes, just after regular cleaning, you may have some sensitivity. The reason it happens is because anytime, particularly when you have laser treatment, we just don't pass laser. We normally, when we do laser treatment for moderate to advanced gum disease, we are also doing some deep gum therapy or the scaling and root planing, or the deep scaling that we do. So when we do that, we pretty much kind of scrape off the tooth surface. So when we scrape the tartar or the calcium deposits over your tooth, so that leaves kind of like, imagine, you're getting a dermabrasion or like some kind of a treatment done on your skin is going to be sensitive the same exact way your teeth are going to be sensitive following the deep scaling or the cleaning or the laser treatment. So it is not uncommon. So you can talk to your dentist or the periodontist about using some over-the-counter toothpaste, as simple as using some Sensodyne may take care of that. So you can continue to do that, and then if it is not does not get better, talk to the treating provider, and then they may be able to provide some stronger fluoride type treatment. That is a prescription toothpaste that we offer, and that should be able to fix the problem. And very rarely, if the sensitivity does not get better, like after several months, and we can apply even some varnish over the teeth, or sometimes we go to the stage that we apply some kind of a filling or like a coating on the teeth, and then we kind of bond it to your tooth surface, and that will get better. Yeah, so there are
Absolutely.
multiple options available.
Yeah, sounds like you can take care of them, doctor.
Thank you. Sure.
Absolutely. On to the next. Hi, I'm Samuel. I had my lower left first molar extracted 13 years ago and I'm now 41. The two adjacent teeth have tilted forward and nearly closed the gap. Okay, well, good for you. I'm finding it very difficult to eat because those teeth are touching my upper teeth at odd angles. Is there any way to correct this?
So you said good, right?
We filled the gap, right?
You fill the gap. No, that's not like he's concerned about the tooth filling the gap.
Oh.
So what he's talking about, like what Shai said was like, so when the teeth are, what Shai was thinking, I should say, right? So when the tooth, here we go, there are two teeth, and then there was a tooth in the middle, and when he got the teeth extracted, now these teeth started tilting like this, and then when there was a gap in the meantime, the top tooth started coming down also. So now his bite is completely messed up. So now he's concerned that he's very difficult to eat because those teeth are touching my upper teeth, right?
Right.
So what he's asking is, what can be done to fix the problem? So what needs to happen is, now these two teeth are tilted, the bottom teeth, so that need to be put back, and then the top tooth is coming down, that need to be pushed down. So a lot of times, if it is not completely tilted down, then we can still use the gap that we have to place an implant at the bottom, and then we can simply shave down. Depending on, if it is not too far down, then we can simply shave the upper tooth down and then put an implant to completely fix your bite. When it is too far tilted down, or when the top tooth has come too far down, and we still able to help you fix your bite, that's not a problem at all. we can simply use braces to push those teeth back on, create the space in between. And then same thing, the top tooth, once it comes down, we can use braces to push the top tooth like upwards and then create the space and fix it, all of that. So anything is possible. So talk to your dentist and they should be able to help you. Talk to your implant specialist, they should be able to help you. Happen to be in the Dallas-Fort Worth area, come see us. Who can help?
We can.
There we go. You got it.
Absolutely.
Yeah.
So, doctor, hi ToothHQ. My upper corner tooth has decayed and rotted. When I visited the dentist and had an x-ray, they told me it's a baby tooth and that my permanent tooth is still present inside the bone. They advised getting braces. I'm 45 years old. Is it still possible for the permanent tooth to emerge at this age, or are braces effective at my age?
Great question. I'm so glad like you're 45 years old, you're still a baby, right? All right, that's what like we make fun of patients. Oh, you're still a baby, right? So you're 45 and then you have a baby tooth and the tooth is completely decayed and rotted. Not a problem at all, and you definitely need to get that tooth taken out because the tooth is rotted. You can't really do anything about it, right? And then you still have the permanent tooth which is present inside, right? And so when you have a tooth present inside, um, you got multiple options now. If you have the right space, you can use braces to bring the tooth in place. Sometimes, when patients get older, they say that, oh, I don't have the patience to go through braces, and are there any other options, right? So then we can remove the baby tooth at the same time. We can remove the permanent tooth also. Then we can give you the option to replace the tooth with the dental implant. So your options are the number one, the baby tooth needs to come out. There is no question on that because it's completely rotted and you don't want to be in pain when it starts to get infected. So get it out. Once you get it out, now you got the permanent tooth that is completely under the gum. So the two options you have are either to get braces to bring the tooth into position, or the next option is to remove the tooth completely to get a tooth replacement using dental implant. Oh, one more thing I forgot to say here is on the option number one, when you decide that you want to get the tooth brought into place using braces, at the same time, let's say you happen to be in our office to remove the tooth, then we do exposure and bond.
Yep.
You know what that means, right?
I do know what that is.
Go ahead, say what it is.
So exposure and bond is when they expose the tooth and then they use like a chain-like instrument or device,
Yeah.
right, to help bring the tooth down, to
Okay.
encourage it to drop, right?
You got it.
Okay.
You got it. So what Shai is saying is at the same time we remove the tooth and we attach a small device to the tooth which is completely under. So we expose it and then we bond this little chain and then we bring it and then we put it outside and then tie it part of the braces, and then your orthodontist is going to use the tooth to use the device to bring the tooth into position. Now magically the tooth which was under the gum line is just going to reappear.
Perfect. Absolutely. It's a magic trick. It's like Houdini.
Yeah, you got it.
Yeah, you can name your tooth
Do-
Houdini.
You want to tell the callers, and a lot of people may not know
Who Houdini is?
Yeah. Houdini the magician.
Yes, he
Yeah.
used to get himself out of boxes. I don't know too much.
Yeah. Okay.
Absolutely.
Yeah.
Perfect. So, I underwent laser treatment for my swollen gums yesterday. Since this morning, I've noticed that the treated area has turned yellow. Could this be an indication of infection? Is it necessary for me to schedule a checkup, or should I start taking medication for an infection? They're freaking out, doctor.
Yeah, well, sometimes patients freak out, right? Like because they either, this is what we say, whenever you guys come in for treatment, we go through like a bunch of information. Sometimes it is very overwhelming. You may not completely understand, and you may not fully know exactly what is going to happen. Although we may be going over some instruction, that particular part may or may not have been covered. And so speaking of that, so going to what you're asking is, you underwent the laser treatment. Now your gums are starting to turn yellow. It is part and parcel of the healing process. There is nothing to be concerned about. Sometimes what happens is, what we call it as a healing tissue. Sometimes because the gum tissue or your mouth is completely wet, some of this healing tissue may turn out to be yellow. Either sometime it may completely die off and it may completely become normal, or it will start to get better over a period of time. So if it does not get better, more than likely you will be going to your dentist for a follow-up or your periodontist for a follow-up in the next like about a week or two. If it is still a concern, talk to them, and they should be able to help you. In the meantime, I don't think you really need to be concerned about, unless you are starting to hurt and then you're starting to see the gum tissue completely starting to recede. You got severe sensitivity that you are not able to manage, then only then I will be concerned. Otherwise, talk to your dentist when you go back, and your periodontist, and they should be able to help you.
Perfect. Well, doctor, we're 20 minutes in. I think we should take a live question.
Okay.
Yeah,
All
so
right.
let's see what you guys have to ask. Is it possible for gum disease to affect a single tooth?
Fantastic question. So, gum disease, whenever we talk about, people are thinking that, oh, is that going to affect my entire mouth? That's what people are thinking. But people may not know that it is going to affect a single tooth. It is going to affect a single tooth. A lot of times it happens because of the crowding means, like, you got teeth, like one you got teeth like this, they are supposed to be in line. Sometimes one tooth goes out of the line. So guess what, like, you are not going to be able to keep that one tooth completely clean, and you're not able to floss, and gum disease is going to affect that one single tooth to the degree. Sometime I've even seen, like, a lot of times I should have seen, been doing this for the last about 30 plus years, the tooth just comes out on its own. And sometimes the gum disease affects the tooth like so badly, and one tooth gets start to wiggly, then we have to remove that tooth. And it's not uncommon for that to happen. A lot of times, I talked about the crowding, but also sometimes you may have like a deep bite affecting just the one tooth. And because of that one tooth affecting, then you are going to start to slam that tooth. And because when you start to slam that tooth, and it is going to have some bone loss, and it is a combination of gum disease, which is the bone loss, and it is also because of the severe bite or the bite issue you may have. So speaking of that, so can you have gum disease around single tooth? Absolutely, you can have. And the real answer should be, can it be treated? Absolutely, it can be treated. If you come to us in a very early stage, we can help you either with the bite or treating the gum disease.
Perfect. Well, thank you for that question. We'll go ahead and move forward with some that we have sent in, and we'll come back to the live, right?
Okay. Right.
Okay. I am experiencing severe tooth pain, and my dentist has advised me to undergo a root canal treatment. There are two options: laser assisted root canal treatment and regular root canal treatment. The dentist mentioned that laser assisted root canal treatment is more successful compared to a regular root canal treatment. Could you help me understand the difference? Is laser assisted root canal treatment more successful, and does it totally eliminate the need for the drilling the tooth? Can a periodontist answer this, doctor? I have a question.
Go ahead. You have your question first, and then
Yeah.
we'll go to that question.
Can you answer this as a periodontist?
Absolutely.
Okay.
Well, we are all dentists. You understand that, right?
Oh,
The root canal.
right.
So, root canal specialist, what Shai is trying to ask me is, how come you are a periodontist and then you are going to answer this question about a root canal? That's what she is asking. Well, we are all dentists and we are all trained to be dentists, and then we all kind of like, have our gigs, and although we do our own gigs, and we all have some common gigs, and then we went to school for, right? And then there are some procedures, that we do, and they're kind of like they fit all the kind of the basic, and goes back to, I'm going to put you on a spot now.
Okay.
All right. So tell me part of the reason why we do the laser. Tell me what's your understanding.
Sure. So the fun thing about laser is when you don't necessarily cut into the gum. Okay, I was going the wrong way. Okay.
All right, okay.
So one reason we do
Why
the
do we do
laser,
that? Yeah.
yeah, to actually kill the bacteria underneath the gum line.
Bingo.
Mhm.
Bingo. So when we do the root canal, so what are we trying to do for the root canal then?
Well, we're wanting to make sure that we kill the nerve, right?
Kill the nerve
Not as invasive, and the
and
bacteria, the
bingo.
infection around the tooth or inside the tooth. Yeah,
Right, that's it. So that's the bottom line. Same thing as what
I
Shai
got
was
an
trying to
A.
say here, right? So anytime we have gum disease, and what we are trying to do is to remove the bacteria around the gum or the bone, is what we are trying to do when we treat gum disease as a periodontist. The same thing, what you're trying to do is whenever you do the root canal, the dentist or the root canal specialist, whoever was trying to tell you, is in addition to doing the traditional root canal, they're also going to do the laser to decontaminate the area, in addition to what we call it as a mechanical debridement. So, for example, in our case, whenever as a periodontist, what we do is we mechanically debride the tooth or clean all the tartar around the tooth, and we pass the laser to kill the bacteria. Same thing during the root canal treatment, the endodontist or the dentist, they are going to mechanically debride or kill all the nerve or the dead nerve. And then now we are also going to add the extra benefit of decontaminating the area and kill the bacteria to using the laser. And that's exactly what they are trying to do it. And in my, will I recommend doing that? Absolutely. Go for it. There is absolutely no disadvantage. Go for it.
Okay, well, doctor, does it
Well,
totally eliminate
kudos
the
to you.
drilling? Thank
Kudos
you.
to you. You
I know what
answered
I'm
part of
talking
that.
about. Yeah.
Yeah, you answered part of that question.
But does it completely eliminate the reason for drilling? I mean, are they able to use the laser in place of
Oh,
it?
yeah, absolutely. So part of this question is, so can we completely eliminate the drilling process? So depending on whether the endodontist who will be doing or the dentist who will be doing the treatment, or depending on the laser they could be using, they're able to completely eliminate the drilling process because the laser itself can completely drill a hole on the tooth. So depending on the type of laser your dentist or the endodontist have available in their office, they should be able to explain it to you whether they have to do any drilling at all, or they can completely eliminate the drilling process and go to laser assisted drilling.
Perfect. A laser has definitely taken over the industry.
You got it, man.
Oh, yeah.
Technology.
Right?
You got it.
Technology.
Technology. Yeah.
Perfect. Okay, well, what type of insurance does ToothHQ accept? Does insurance plans typically cover dental laser treatments? And how much do they usually cost? Tell me, Dr. Vadivel, do you know?
So am I qualified to answer this
I don't
question or
know.
no? No, you are more qualified to answer this
I think
question.
so. May I take over?
Yeah, go ahead.
Okay.
Yes, yeah.
What type of insurance does ToothHQ accept? Well, any PPO to start, but honestly, bring us what you have. We'll definitely claim out on your behalf, and hopefully, you can recoup any funds or they will cover something on your behalf. So, definitely bring it, give it a try. We'll accept it.
Bring it on, man.
Bring it
Bring
on.
it on. Yeah, okay.
Absolutely. Do insurance plans typically cover dental laser treatments? The answer is yes. For the most part, your insurance will cover pretty much anything that we typically offer. If for any reason that they don't, we can definitely assist you with getting the financial aspect taken care of so that you're not facing that burden. And how much do they usually cost? Oh, this is still me?
Yeah.
Oh, okay. Well, it can vary, but I will say it's reasonable. So definitely don't let the financial aspect kind of deter you from getting it done. Visit your local office, come and see us. We'll give you a price. We'll go over the entire treatment plan with you and assist you as best as possible.
But what do you do for people when they are trying to fit this in their budget? Tell me, how do they help them?
Well, we have more than 3 different third party options. So we'll definitely be able to assist you with getting a payment plan. And we can make sure that you make payments starting 30 days after your treatment. No deposit needed.
Perfect. Well, so the bottom line is so we definitely can help you find the best option for you, and then the best option as far as the treatment as well. And that is something that is going to fit your budget, and we can definitely help you with the condition of your gums, and then take it from there. And it does not cost you anything to come see us because
Free consultation, free CBCT.
you got it.
Yeah.
All right. Okay. You got it.
Absolutely. Doctor, you want to play a game?
Yeah.
Okay. Let's go.
Game. Okay.
Yeah. We're gonna play rapid fire.
Oh, okay, okay. I thought you were gonna play like I like basketball.
Oh, okay, I can't shoot, doctor. I'm
Okay,
sorry.
all right.
I heard basketball season just started though.
Okay, man.
Did you
How are the
watch?
maps doing? Okay, all right, all
All
right.
right. So back to this game. You ready?
Okay, you got it.
You have to answer a question 30 seconds or less or in 1 to 2 complete
Oh, yeah, yeah,
sentences.
yeah. I thought you said rapid fire, right?
Rapid
Okay,
fire.
all right. I'll try. Uh,
Okay.
you
What?
gotta watch me. Don't if I'm
Okay.
talking too much, then you say that.
I
Okay.
got you. I'm
All
going
right.
to smack you.
All right. Okay,
Okay.
man. Yeah.
What is one question that a dentist is tired of hearing from their patients? Be honest.
Um.
Only 2 lines.
Okay. Do I really need to floss?
Oh, that's a good one.
Do I? Yeah.
That's
Do
a
I
good one.
really need to floss? And some people, believe me or not, like they even, do I really need to brush twice a day? No.
No, they don't.
No, no, no. They do ask.
Okay.
No, don't ask me that question. That is what I'm saying.
Oh,
You really
gotcha.
need to brush twice a day, and you really need to floss twice a day. Yeah.
Okay, really good. I have another one for you. Is it okay to smoke just 1 cigarette 72 hours after getting an implant post?
Um, no is the answer, but do patients do? Yes is the
Yes.
answer.
Mm-hmm. Okay. Why are both soft and medium toothbrushes available if dentists generally advise using soft bristles? Do they typically say soft bristles?
Yeah, they do. You do have soft and medium bristles, and soft bristles are available for some. For like it's just on the we need to have some soft bristles. What if somebody is not averse to using the medium? So we need to have some options available. That's the reason why. And particularly in our office, we use the soft toothbrush because after surgical procedures, we don't recommend they use a medium one, and they need to use the soft.
All right,
There
that
you
one
go.
got expensive.
Yeah.
Okay, how does gum disease lead to teeth falling out, considering that teeth seem to stay in the skull even without the gums?
Gum disease eat the bone away. That's why the
Mhm.
teeth tend to fall out. No matter whether they are in the skull or not, the bacteria are going to eat the bone away, and hence they fall out from the skull.
That's right. Should I brush my gums? That's a good question.
Absolutely, you need to brush your teeth, and you need to brush your gums, and you need to take care of your teeth and the gums. So that's why we say that gum health is very critical to keep your teeth.
Perfect. Okay. You did
Did I
really
do
good.
good?
Yeah, you
All
made
right,
it.
man.
I wasn't sure at first. I
Okay.
thought I had my opportunity, you guys, but I
Okay.
guess
All
not.
right. Okay.
All right. I delivered baby 2 weeks ago, and I'm unable to
You
walk or.
did?
No, I did not.
Oh, you did. Oh,
Yeah,
the
not my
caller did.
question.
Okay,
Yeah,
not your
okay.
question. Okay.
So sorry. Next question, you guys. I delivered my baby 2 weeks ago, and I'm unable to walk or sit for very long. One of my upper right teeth is very painful, and I'm worried. Is it common to experience tooth pain after delivery? If treatment is needed, is it safe to use anesthesia while breastfeeding? Should I wait or start the treatment?
So, so multiple parts to this question. I delivered the baby 2 weeks ago, unable to walk or sit very long, right?
Mm-hmm.
Um, it is like I'm sure you're probably going through the pregnancy side of it, like or the delivery side of it, and you're already going through like a lot of stuff. In addition, you got this pain also on the upper tooth, um, and I don't think it is because of the delivery you're experiencing the pain. It was probably like, there. It is just coincidental. It started hurting right as soon as after the delivery. A lot of times, it may be, we say like it's a stress or like the trauma that you may be going through that may be causing the pain you are experiencing also. It probably was there, but it just coincidental. It started hurting now. And to go back to your question, can you get the treatment done while you are nursing the baby? Absolutely. You don't want to have any type of infection in the body while you're nursing the baby because what?
It could transfer.
Bingo, right?
Yeah.
Particularly when you're nursing the baby, it can transfer to the baby also. So you don't want to be doing that, and you don't want to be going through the to be taking pain medications and particularly stronger pain medications when you're nursing. So my recommendation is absolutely um, go see the dentist and when as surgeons and let's say you need to have a tooth removed. All we do is like ask you to to get the treatment done, and we still go through the proper treatment. And it may and may not be possible sometime for you to nurse the baby for like a day or two, and we recommend you pump the milk and then keep it and ready for your baby, and get the treatment done during the time that you are going through the pain medication treatment. If you have to, then you pump the milk and you discard it, but then you use the milk that you already have, and then go back to your routine like after like a day or two of recovery.
Perfect. All right. Get the treatment done.
Do not even
Absolutely.
delay. Yeah.
Don't delay. Absolutely. So, doctor, hey, I've heard a lot about gum disease since both my parents lost their teeth in their early 50s. Am I more prone to losing my teeth soon? If so, what are the possible warning signs of gum disease and how can I prevent it early?
Well, you answered. You sound like you're probably like aware that the first thing, kudos to you. So you understand that your parents lost their teeth, and you're probably more prone to getting the gum disease. Now you're looking for signs of gum disease, right? So many things that happen: swelling, bleeding, mobility of your teeth, the teeth looking long, bad breath, and you got like a stained teeth, and you got loose teeth. All of these are kind of signs of gum disease, and you definitely want to be watching for them. To going back to how can you prevent this from happening is to brush and floss, and those are the real basic stuff. Brushing your teeth twice a day, flossing your teeth twice a day. Of course, do you have some genetic predisposition to gum disease? Yes, of course you do. But can you overcome that? Yes, you can overcome that by brushing and flossing, and then going to see your dentist on a regular basis. Don't forget that. And if you happen to have like a severe gum disease going on, come see a periodontist. And sometimes the periodontists are able to treat the gum disease, maybe in a better way than your dentist are trained to do, and they can definitely help you.
Absolutely. Doctor, did you go over warning signs? Like, what are the ways that he could tell it's
Oh, there's
early?
swelling, bleeding, and early signs are as simple as like bleeding gums and
Mm-hmm.
bleeding, swelling, bad breath. All of those are the warning signs. So don't ignore them.
Yes, absolutely. Okay, doctor, on to the next. Hi, doc. I brush my teeth regularly and use a tongue scraper to clean my tongue. The roof of my mouth is deep, and I find it difficult to keep it clean. It also feels very itchy. Is there any specific equipment to clean it?
So
Hmm, that's interesting.
uh, So you guys all know about brushing and brushing your teeth and brushing possibly your gum and keeping your tongue clean.
Hmm.
How about the roof of the mouth? And that is exactly what they're talking about. Whenever you're brushing your teeth or brushing your gums, and we always recommend you brush the tongue also. Then that's why this scholar is saying he's able to use a tongue scraper to keep your tongue clean. You use your tongue scraper or the brush. The same toothbrush you should be able to reach using you
Okay.
turn the other way around, just like you are doing this, and then turn the other way around, reach it all the way.
Hmm.
And sometime what we recommend is like this caller is experiencing because he has a really high roof palate, high arched palate, and he's not able to reach it up the top. So that's when like you buy like some really soft handled toothbrushes, and then what we normally recommend is that sometime to make the bristles kind of softer, we recommend you soaking it in hot water so it becomes really soft, then you can reach all the way in. And sometime you put it on really hot water, even the handle of the brush can get really soft, then you can bend the toothbrush a little bit. Or I would recommend just maybe even use something like you bend a toothbrush and then keep it like in your bathroom, an extra toothbrush. You're able to always use this to reach the roof of the mouth. And to answer the other question, why does it feel itchy? So sometime when you have food stuck in there, or like it could be other reasons, and if you're not able to clean it really well from what you're describing, you may have some fungus formation, like some bacterial formation on there that you're not able to reach it clean. So once you start to keep it clean, then you may start to feel better.
Perfect. Okay, so how about we turn the reins over back to the viewers? Want to
Oh,
do a live question?
yeah, man, let's go.
Let's do it. Okay, so I see here, does dental insurance cover emergency treatments? Is this a question for me?
Yeah,
Okay,
yeah, you should be.
sure. The answer is yes. It
Yeah.
works like any other standard dental appointment. You'll go in, they'll give you a treatment plan, they'll show you the insurance estimate, they'll show you your out of pocket, they'll assist with financing if necessary. Otherwise, you'll see what your insurance is going to cover on your behalf. Absolutely, they'll cover it for you.
So the answer is dental emergencies are covered by insurances, and more often than not, like, so even they may not be covering regular treatment, but they are definitely going to be covering the emergency treatment. So if you really want to find out, talk to your dentist, and then before you even go to the dentist, and you can just pick up the phone, or you can log into your insurance portal and able to see what kind of emergency treatment your dental insurance is going to cover.
Impressive, doctor.
Mm-hmm.
Did you know you could call your insurance?
Say again?
I didn't know you knew you could call your insurance.
Sorry. I do know the front office
This
stuff,
guy.
man. Yeah.
Okay, we'll
Yeah.
have to put you in the front one of these days.
There we go. I'm not answering the phone though.
Why don't you want to answer the phone?
Maybe I'm not as good at as you guys are, right?
Okay,
Yeah.
fair enough. Well, hello, doctor. I have joint problems. We'll come back to a live question a little later, you guys. Okay, so hello, doctor. I have joint problems, and there's a noise when I open my mouth. Could laser treatment be an option for this? I'm very anxious about undergoing surgery, given the frightening stories I've heard about joint surgeries.
Um, so what this caller is asking is they're getting a popping noise. We call it as a temporomandibular joint or a TMJ. So whenever you have open and close like this, just like your knee here, like so you hear some popping noises in the knee, so you're going to hear some noises in the joint. So when you have those noises and in the TMJ, so you have multiple options. Either you want to treat it surgically or you treat it non-surgically. So it looks like this person is concerned about treating it surgically. Sometimes surgical is not always the best option, particularly the TMJ surgeries. Not all of them have the best outcome, even surgical outcome. So is laser an option? Absolutely. So nowadays with the technology, the way the technology has evolved, we call it as a photobiomodulation therapy. So just by passing the laser light, we are able to repair what we call it as a ligament that is on inside the joint. Like you have like a small ligament that goes above the joint, and then also you have a lot of muscles attached to that also. If you are able to handle the ligament, and if you are able to handle the muscles and like or handle the inflammation, or to resolve the inflammation on the lining or on the muscle. Sometimes a lot of times we have seen the TMJ disease gets better just by the laser treatment. So talk to your laser specialist, to your dentist, and if you are in the Dallas-Fort Worth area, come see us, and we can talk to you about the photobiomodulation therapy for the TMJ treatment.
Absolutely. Come see us. Alrighty. You ready for the next one?
You got it. I'm looking at it right here.
Okay, perfect.
Yeah.
I'm 45 years old and a few of my teeth are shaking. I lost my back teeth a few years ago, so most of my chewing gets done with my front teeth. When I went for a replacement option, I was advised to get a root canal. My concern is, will the shaking teeth get better? How long will these teeth last, or should I consider getting all the teeth removed and proceed with implants?
All right. The shaking teeth are the part of the reason why the teeth are shaking is because you already mentioned that you don't have the back teeth. So when you don't have the back teeth supporting on the back, the front teeth, you are just going to keep doing that, and then because there is no balance, and there is no balance on the teeth, the front teeth are getting shaky. So if you are going to get a root canal treatment done, um, is that going to fix the problem? It is not going to fix the problem of the loose teeth, and or getting the implant, do you really need to get all the teeth removed and replace them with the dental implant? It's very possible, depending on how shaky they are. It may be the best option to remove all your teeth and excuse me. It may be best to remove all your teeth to replace them all with the dental implants or a complete set of teeth. Or sometime, if they are not too loose and you really don't have to, once you put the teeth in the back, like then the front teeth should start to get better. The ones that are needing root canal, you can replace them with individual implants, or you can get them treated with the root canal treatment, and that should fix the problem.
Absolutely. So you can keep some of your teeth, right? Yeah.
Absolutely, yeah.
Perfect.
So full mouth implants can be done, but not necessarily always you have to go for full mouth implants, and it can be as simple as what we call it as a few teeth can be replaced with the dental implant.
Lovely. I had my wisdom teeth extracted a few weeks ago, and I'm experiencing ongoing numbness in my jaw. I understand this numbness is a surgery related complication, and I'm currently taking vitamin supplements for it. I've come across information suggesting that laser treatments might be beneficial for this condition. Is it accurate, and does ToothHQ offer these laser treatments?
Absolutely, we do. So what the laser does is, we call it as a stimulation, right? That's what it does. And so or the modulation, that is what we say. So the laser offers like a lot of photobiomodulation or like a laser stimulation, and these treatment can be done anytime when you're particularly recovering after a procedure, and if you have some numbness, and it is going to take some time for things to get better. In other words, you're enhancing the recovery process. That's what you're trying to do. So not that just the vitamins alone cannot help you. Yes, of course they can. You're offering additional help by using the laser to do this photobiomodulation, by helping the nerve kind of like a recover faster. Or if there are sometime you may have the muscles here like kind of pressing on the nerve, and then now you're recovering, or the swelling pressing on the nerve, which is what is causing the numbness. By enhancing the recovery process or doing a photobiomodulation, you're enhancing, or you're making the swelling get faster, and then also that will help make the nerves recover faster also. So the bottom line answer is absolutely the laser can help in addition to whatever that you are doing.
Perfect.
And we do offer, by the way, if you happen to be in the Dallas Fort Worth area, come see us at ToothHQ. There we go, ToothHQ.
Absolutely. Okay. So, doctor, I feel like we should do another live question.
All right.
They're just coming in hot. Okay. Hey, I've got some gaps between my teeth that I'm really self-conscious about. Is there a way cosmetic surgery could fix this without wearing braces?
Absolutely. The answer is yes. So if you have gaps in between your teeth, can cosmetic dentistry fix your teeth without having to do braces? There are so many options available. Technology can help a lot. Technology can help a lot. Um, Even I know you mentioned braces, and I don't know whether you're talking about like the traditional braces, and that's why you're concerned about. If you're concerned about, then we got invisible braces nowadays. You don't have to wear what we call it as a metal industry in your mouth anymore. So you can wear as simple as clear brace, even clear braces. You don't have to have the metal anymore. So we do have for clear braces too. Talk to your dentist, and then you can have Invisalign, which is almost like a tray that you got to wear, that can help here, that we have here. See, you can't even see here, right there, see that? Yeah, there we go, right? So it is invisible, so you can wear them on the top of your teeth. Nobody knows that you are wearing that. It can correct your teeth. If you're not even ready for that, then can cosmetic dentistry fix your teeth? Absolutely. Yeah, talk to your dentist and they can talk to you about the options.
Absolutely. That was a really good one.
Mm-hmm.
Okay. So, doctor, I have another question for you. If I've lost the tooth next to my wisdom tooth and I'm planning to use a partial denture, should I consider a bone graft when I have my wisdom tooth extracted to accommodate the partial? Oh, I can answer this.
You can.
Mm-hmm.
Did we talk about this like a few days ago?
Yeah, we talk about it all the
Okay,
time.
okay, all right.
Yeah,
Okay. Well, we
absolutely.
had a patient actually with the same condition
Mm-hmm.
ask the question, hey, should I really get the bone grafting even if I'm not considering implant? And
Oh,
you answered that
absolutely.
question, right? So go ahead. That's exactly the same
The
thing.
answer is yes. It's to support the gums to ensure that it doesn't like descend or thin out.
Support the gum
Preserve.
and the bone.
Yeah, preserve the
Right, the
bone.
bone,
Absolutely.
right? Yeah.
Mm-hmm.
So the bone grafting is done to preserve the gum and the bone, particularly, right? So what happens is, this is the bone right here. See that? This is the way, like, so whenever you have teeth, the teeth look like this, and then you have the bone starts to thin around after a period of time when you don't have stimulation from the tooth or stimulation from a dental implant. So the partial denture does not stimulate the bone. Only the teeth or the dental implants can stimulate and keep the bone. So when you do not have uh, a teeth or implant, so the bone starts to disappear like this. See here, from here, and it came down here, here, and then like bone becomes really thin. So that is why it is so critical. So it's almost like, imagine when you dig a hole on the land and you put some concrete help make it stay for a long time to prevent any type of landsliding. That's exactly what the bone grafting does. Particularly if we know that you are going to get a partial, we put some extra hard bone that takes a long time to dissolve. So we can use that special bone to make sure that it is not going to erode away at all within a short period of time.
Absolutely. Get the bone graft. No matter what your future plans are, you never
Exactly,
know.
whether it is implant or whether you're going to get a partial denture. Absolutely. Yeah.
Perfect. Okay, doctor. Well, what are the potential long term effects of using 3D printed dental implants in terms of durability, integration with the bone, and overall health? This person did their research. Integration with the bone.
Yeah. So fancy word, right? Integration with the bone, right? So um, uh, so what this person is asking is, 3D printed dental implants, and that's what they are talking about. I think there is a little bit of a confusion on the term that you may be asking. I don't know whether you're talking about the 3D printed guide that we are using to for the dental implant procedure, or you're really referring to the 3D printed dental implants. And we have come so far as far as the technology. We can offer the 3D printed guides, and then in the past we used to send it somewhere. Now we can print it right in house to do the 3D printed guides. But to my knowledge, the dental implant cannot be 3D printed. So the actual device that we implant inside your bone, and to my knowledge, it cannot be 3D printed at this point of the game. So will it be available tomorrow? Is somebody working on it? To my knowledge, like, I don't think anybody is available at this point. Could somebody be working on it? But it's very possible, right? So if you can, you use the 3D printed technology to for the dental implant. It is very widely done, and we use it in our dental office, and that's not like that is not a problem at all. And to answer your question, um, on is there any long-term effects on doing that? Actually, it's a great benefit, and uh, 3D guided dental surgery. It is going to be like more of a customized solution as opposed to we are doing a lot of guesswork. So that is not a problem at all, and I absolutely would recommend that. And then to answer your question on the integration, what the that you're asking is, whether it is a added benefit to the integration. I don't think there is any benefit because, as I said earlier, the dental implants comes from the dental implant manufacturers. They all have integration, which means like the bone fusing around the implant.
Mm-hmm.
And I don't think there is anything to deal with the 3D the models or the 3D printing that we are going to do with integration, because they all have the integration that is common to the dental implant industry.
Absolutely. Well, they definitely looked into that one. That was a good
That's a
one.
really good question. Yeah, really
Hmm.
good question. Yeah.
Perfect. And dentistry seems stuck in the Middle Ages compared to advancements with all this laser talk. Is that where we're at?
Yeah.
In other fields like organs transplants, kidney, liver, heart, even eyes, which have countless nerves and veins, yet dental care remains rigid. Limit to either root canals or implanting metals and plastics in our mouths. The concept of filling teeth with natural biocompatible materials like hydroxyapatite isn't widely embraced. Instead, the focus is still on using plastics and potentially toxic metals. Why hasn't dentistry evolved beyond these outdated methods? That was an evolved word. That was an evolved word, doctor.
Yeah.
Can
Yeah.
we expand on what hydroxyapatite is?
Well, the hydroxyapatite is a tooth material. The tooth is
Oh.
made of that material, hydroxyapatite, and that's what this caller is referring to. Great, great question, by the way. Very critical thinking, right? So what you're essentially asking me is, you know, can we essentially transplant a tooth, right? Or
Oh.
can we, because this, you can do the kidney transplant, heart transplant, liver transplant. Why can't you transplant a tooth? So um, you can do the transplant within your own body or within somebody else's body. For example, dentistry we have looked into doing two ways. One is we are transplanting a tooth from one place. For example, let's say somebody has a wisdom tooth that is not needed or it is underneath the gum line and you're going to end up losing a tooth in the front here. Can we remove that and then can we put this in here, right?
Mm.
That is number one. And can we remove the tooth from somebody else's body and then put it in somebody else's body, right? And that's the other possibility, right? We have looked into both of them. Sometime, in medicine, we say the risk versus the benefit, or we do a lot of cost benefit analysis, whether it is really worth, just going to an extent to get the tooth from somebody else's body and put it in your somebody else's body to make it work. The answer is like we have tried all of this and it is may not be cost effective to do the procedure. There are You can do the implant or maybe 1/100th of the cost of getting a tooth from somebody else's body and then try to do and all of that. And again, even getting it from your own body to predictably do the procedure, give it to the extent that you're going to be happy, we are not able to do that. And that's why, and going back to the cost benefit analysis, implants are much more predictable as compared to going with the transplanting your own tooth or transplanting from somebody else. And that's why we haven't gone to that extent of the transplant. Whereas opposed to that is not possible in the medical world. That's why we are going that route. But we have other options as far as the dental implant, and that's why we have to do it. So in simple terms, when your knee goes back, they don't transplant it from somebody else's body. It's the same way. So whenever your tooth goes back, we transplant it with a metal, which is an easier option as opposed to the other.
Absolutely, doctor. What do we call those type of people with such a complex question? What do we call them, doctor?
Nerds. What do you call them?
Smarty pants.
Smarty pants. There we go. Okay, oh yeah, you're going the smarty pant route. Okay, you got it.
Mm-hmm.
Yeah. Critical
Perfect.
thinkers, right? There
Yes,
we go. Critical
absolutely.
thinkers. Yeah, smarty
Okay,
pants.
you
Yeah.
guys. Doctor, it's getting close to the end. We have to go out with a bang. That question was a bang, though. That was a really good question.
Mm-hmm.
As a model, I experienced severe depression after having my third molar removed. Could you explain why this might have happened?
I don't know. I can say that I can relate that it is because of you got the third molar, you got the molars removed. People go through depression. I've seen that happen multiple times after any type of surgical procedure. It is very possible that you are probably going through this phase after your oral surgical procedure. And in my opinion, I'm really thinking it is going to be like a very, very transient phase because we see this happen. right after oral surgery, people start grinding their teeth. People start experiencing a lot of pain. People start experiencing delayed healing. All of those things are not uncommon, and that may be leading to the depression. So you are going to get through this, and don't worry. Talk to your dentist. All right, all.
Absolutely.
Thank you very much, and
Yes,
we look
ma'am.
forward to seeing you the next time. Thank you very much.
Thank you.